Welcome to this video on maternal stress. In this video we will explore definition, prevalence, predictors, impact on fetus/infant, and intervention of maternal or perinatal stress. Before delving into maternal stress, let us briefly define stress. Stress is defined as the body's response to a threatening environmental stress by instigating the sympathetic nervous system and hypothalamic pituitary adrenal axis. It is necessary for survival and keeps us safe when faced with dangerous situations. However, stress affects everyone differently. A person's perception of stress can turn an experience into something positive or negative. Perinatal stress can have negative effects on offspring. Definition of maternal stress. Maternal or perinatal stress refers to the stress that a mother experiences during and after pregnancy. It can be chronic and affects women differently, depending on their perception and ongoing life events. It can also be acute, linked to sudden changes in a woman's daily routine or environment. As clarified by the Stress in Pregnancy International Research Alliance, Spiral, maternal stress can be grouped into objective stress and subjective distress. Prevalence of maternal stress. Approximately 70 to 80% of new mothers experience negative feelings or mood swings during the first few days after giving birth due to hormonal shifts. Mental Health America, MHA, 2022. It is estimated that 7% to 20% of pregnant women are affected by depression during pregnancy and more likely to develop depression and anxiety during the first year after childbirth, MHA 2022. Study also shows that a striking 70.6% of mothers with high depression reported multiple perceived stressful life events. Quattraro and Grussu, 2020. Predictors of maternal stress. Maternal or perinatal stress can be influenced by a variety of social, emotional, and environmental factors. Understanding the key predictors of maternal stress is essential for developing effective support systems and interventions for mothers and families. Perinatal stresses are altered by biological factors, medical conditions, history of miscarriages, and the mother's age can all predict prenatal anxiety and depression. Psychological factors. Trauma-related life events can greatly influence stress levels. For example, experiencing multiple stressful life events may increase the likelihood of postpartum depression threefold. History of maternal mental health issues and substance abuse, effects of psychotropic medications, and domestic violence also play a role. Maternal perception of stress and coping strategies are critical. Physical/social factors. Socioeconomic status, such as financial constraints and immigration factors, can impact maternal stress. A lack of social support, especially from the spouse or father of the baby, can also contribute. Impact of maternal stress on fetus/infant. Maternal stress can alter the DNA of a fetus, affecting stress responses, psychological behaviors, and neurodevelopmental outcomes. Infants of mothers who experienced prenatal stress are at an increased risk for early delivery, preterm birth, a lower birth weight, difficulty soothing, excessive crying, dysregulated feeding and sleeping, gastrointestinal issues, including loose stools and allergic reactions. Long-term effects. Maternal stress is associated with adverse outcomes for babies and may lead to cardiovascular, metabolic, reproductive, and neurological diseases as the child grows. There is an increased risk for autism, ADHD, conduct disorders, decreased cognitive performance, asthma, altered fingerprint patterns, reduced longevity, and lower school performance. Children of mothers who experienced elevated anxiety and depression during pregnancy have a 13% chance of developing a mental health disorder later in life. Quattraro and Grussu, 2020. Maternal stress intervention. Early assessment, screening, and referral are crucial. Proper assessment during different trimesters can lead to early detection and reduction of stress levels. Multiple assessments help identify high stress, depression, and anxiety levels in mothers, as well as detect stressful life events and coping mechanisms. Tools for screening may include psychosocial assessments, Patient Health Questionnaire 9, PHQ-9, Edinburgh Postpartum Depression Scale, EPDS. Other medical tests may be necessary to rule out additional conditions. Therapy options. Therapies such as cognitive behavioral therapy, interpersonal psychotherapy, mindfulness, yoga, and stress reduction techniques have proven effective. These methods are beneficial for both maternal and child outcomes, improving cognitive, language, socio-emotional, and motor development in children. Pharmacology. While medications like antidepressants can treat severe prenatal mood and anxiety symptoms, they are sometimes not recommended during pregnancy or while breastfeeding. Consultation with a psychiatrist is essential for guidance on psychotropic medications. Conclusion. Understanding and addressing maternal stress is crucial for the well-being of both mothers and their children. Through early intervention, proper screening, and effective therapeutic approaches, we can mitigate the negative impacts of stress during and after pregnancy, fostering healthier outcomes for families. It is essential to prioritize maternal mental health, as it lays the foundation for the future development of the child.